Can y'all still hear me?
Yeah, I can hear you.
Yep, we can hear you.
Go figure. My headset just disconnected. Gotta love technology.
I just sent you the link.
Okay. And this just came through. Respiratory therapy, right?
Yes.
Yeah. June 12th live stream. Paste it there. Save. Publish. Just let me go verify it took. And respiratory therapy. June. It's there. Okay, we're good.
Okay, thank you.
You're welcome.
Raymond, can you hear me?
Yes.
Okay, everyone made it over to the room and you're gonna see.
This is Mike. Check over.
Mike, you're very broken, but but we hear you, but it's not very intelligible.
Yeah. Mm-hmm.
We see you fine, Mike. Your audio is a little fuzzy. Mr. Sent, it's okay for Mr. Raymond to start the meeting?
Yes, sir. We good to go.
Okay, Raymond, you're on.
All righty. I'd like to call this meeting to order. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Jacinda, please confirm you verified the identity of all tele and video conference participants.
We have.
Does it sound clear and audible to the public and those on the tele and video conference?
Yes,
sir, it is.
All additions to the executive or public comment must be made presently, as we will no longer make additions to the agenda after the close of the public session.
Mr. Raymond?
Yes, sir.
I'd like to ask the committee's indulgence. We had a query come in over the weekend about a duly licensed person in our agency who would like to use one set of CME for his second license in respiratory therapy. And I wanted to add that to the agenda today to discuss.
Do we have to take a vote on that, Dr. Van?
It has to be unanimous to add it. Yes, sir.
I make a motion that we add this new business or for discussion.
Second. Do we have a second?
Second.
second by Dr. Zima. Is there any discussion? All in favor?
Aye.
Aye.
Aye. Any opposed? Okay, we will add the item to new business under the agenda.
And it is the last item. Thank you very much, members.
Mhm.
Is there any public comment on adding that to the agenda, Dr. Van?
No comment at this time, sir.
Okay, can we have a roll call and quorum confirmation, please?
Yes. All right, and I am not in any particular order. My respiratory therapist, Brett Stafford,
Present.
Sheila Guidry,
Present.
Mike Nolan, yep, nope, Mike,
He's muted.
okay, I see him though, Mike, and we've heard him. Raymond Peasany,
Present?
Beth Hamilton,
Here.
Diana Mirandino, Dr. Hugo.
Here.
Okay, those are our assigned board members with 100% present. I also have in attendance, Miss Priscilla Bartholomew,
Present.
Miss Johnson.
Present, can you hear me?
I can.
Okay.
Miss Patricia Wilton,
Sorry. Yes, I'm here.
I got it. Dr. Van,
I am here, ma'am. Thank you.
Jacinta,
I'm here.
okay, and then I have Tracy Morrow coming in for IT.
We also have Olivia.
Olivia. Thank you. All right. We've got a quorum.
All righty, we'll proceed with our business and our agenda. The meeting was called to order. Okay, we'll move to is there any public comment at this time, Dr. Collada?
No, sir, there is none.
All right, we'll move to old business. We have the approval of the minutes of March 13th, 2023 that were included in your packet. Did everyone have a chance to review those? Do I have a motion to accept the minutes as presented?
I motion to accept.
Do I have a second?
Second.
Second, Beth,
I got
any discussion? All in favor? Opposed? Motion carries. Is there any public comment, Doctor?
No, sir, not at this time.
We'll move on to item 2 under old business, revisions to the rules and regulations. I apologize that I did not get a doodle out so we can get this ball rolling, but at this time, I'd like to entertain some suggestions on how we should move forward with this, setting dates, if everyone is comfortable with that. Does anybody have any suggestions?
I'd like to suggest that we definitely meet in person and not Zoom, so we could get this done in a quicker manner. It could be, I don't know, maybe on a Sunday over into Monday.
Any other discussion?
Raymond, I agree with the in-person thing just because we were able to take it and actually get to it pretty quick last time. And I think if we've got the ones that we did revise previously, going from those kind of as a whole, I think it'll go quicker.
Any other discussion?
Good, we have copies of that, that document you were just speaking of, Ms. Ferrandino, so I can get them ready for us all and have them prepared in advance.
Dr. Van, yeah, you were given copies of this whenever we submitted it. So yeah, I'll
All
have
right.
to go back and find it.
I'll look for it. If I can't find it, I'll get back to you. Thank you very much.
Okay,
Diana, would you mind just forwarding to all members on the
I
board?
will.
Because I don't think Dr. Zima received a copy.
Yeah, I don't-
Okay.
Do
And,
y'all,
and I'll
do
be,
y'all really think that it's gonna be able to be done in that time frame? I'm thinking more of a Saturday, Sunday over into Monday.
so making it a weekend kind of thing.
Yeah, as a buffer, and if we finish early, then we, can go home. Now, we're talking about meeting in New Orleans at the board office.
That's where we met last time.
Yeah. Okay.
That's what we'll have to do, yeah.
Okay.
And because, and it will be a public meeting, so if the public wants to attend, they'll have to come to New Orleans to do so.
Okay. Diana, would you mind sending out a doodle poll and seeing what's a convenient weekend for our members, please, and the board?
Okay.
How soon are we thinking?
Well, I'll tell you right now, my weekends are getting booked up really quick. So if you were to ask me, I'm gonna say it's probably gonna be looking at I'm thinking end of July going through August. End of August. I've got some I know I've got some conferences and other commitments due to weddings and whatnot. And then it may be something that we do in September, but I'll send out and we can plug in. And again, one of us, or if I were missing, that's fine. I can send my comments with somebody else. But I'm just saying right now, I'm thinking August, September. I don't know that we can turn it around any faster than that.
Okay, so if you send out that doodle poll, we can go from there.
Okay.
And Ms. Marandino, if you would be so kind, is don't pick a weekend before the Monday board meeting, because that would be difficult if you ran over. We can't have both of those meetings going on at the same time.
When is that? Did you know when the next one is, or I can go to the
website has it, but the current dates are at this time, June 26th, 27th, July 24th, 25th, August 28th, 29th, September 25th, 26th, and October 23, 24.
Okay. All right. Got it. Thank you.
Thank you.
Raymond, I'd like to just give Dr. Hugo a little bit history on this. This is not something, Dr. Hugo, that we do on a regular basis. It's like every so many years we revise our rules and regs. So you just happen to pop in when we're doing it.
Well, it's good because it kind of flows into my orientation, so that way I get a good grasp and understanding of those rules and regulations. So I don't mind. I really appreciate it.
Yeah.
Good. Good. All right. Is there any public comment, Dr. Van?
1 second, I'll check both emails real quick. No, sir, not at this time.
All right, we'll follow up to item number 3 on the agenda. Any board opinions? I think at our last board meeting, we gave directions to you, Dr. Van, and Ms. Patricia to go ahead and bring forward our recommendations to the board Have those been taken care of? So we can take that off our agenda?
I plead forgetfulness.
Yes, yes, they were presented to the board and the board approved them.
Okay,
What's with that?
so all the letters were sent out, Miss Patricia? Or that needed to go out?
Yes, yes, sir.
Okay. Have we had any follow-up from any of the parties?
Not to me, sir.
Okay. All righty, we'll move on to, is there any public comment, Dr. Van?
No, sir, not at this time.
Follow-up, committee appointments. I did speak with the boards and commissions last week because we, still waiting for a replacement for one of the respiratory therapists, LHA representative, and one physician. She apologized that she will put that ahead of her agenda. Somehow it got slipped behind a little bit, but she assures me the session ended last week, and she will be out for a week or so, but she's moving that ahead, and she hopes to have some appointments by the next time that we meet. So we'll go from there.
I'll hang in there till you replace me.
We appreciate it. Is there any public comment, Dr. Van?
1 second, checking the other email. No, sir, no public comment at this time.
Okay. Is there any old business anybody would like to bring up at this time?
Raymond, just one thing, and again, I don't think we have to come to conclusion on this, but Dr. Van and I had I sent him again another copy. So Dr. Collada, have y'all thought about doing a survey for the initial licensure process after the license goes out?
Define after the yeah, we are in the process of doing that.
Okay.
And the bigger issue is we are making some additional modifications to use the document system, parchment. And I think that will expedite things. And also I need to tell you that there is a new system coming on board for criminal background checks, because that is traditionally our rate limiting factor.
Okay. I just wanted to know, I mean, like I said, I exchanged it and that's fine. So before we get carried away with there's problems, survey to see if there is problem or there's just a handful of people that are having issues. And it may be more their issues than ours.
Normally, every time you ask me to look into something, it's because somebody either hasn't provided a document, hasn't checked their portal, or haven't communicated with their licensing analyst. But we do watch the numbers fairly carefully, and we find that things are moving along pretty well.
Thank you.
Great. And excuse me, doctor, what was it in reference to the criminal background checks that's coming on board?
The state of Louisiana State Police, at the urging of the 4th floor lady that you spoke to, she and I and a number of other people who do these criminal background checks, they do, so you'll know, not advisory committees like you are, but board members, commissioners, and other members of state agencies have criminal background checks also that they do at the 4th floor level. We do them on hundreds of thousands of people, all the time. And we are actually smaller than the Department of Education. The state police is changing the system, and it's going to appear as follows. There will be a contractor that the state police is using. It's called IDEMA, and they will have approximately 18 offices initially around the state that anybody can go to. When you put an application into us, the way it will work is once this becomes active, we will actually send you a piece of paper by PDF file that has some places for you to sign. It also has a 5-digit code that reflects our agency. And you will take that piece of paper and go to IDEMA, pay them the fees. It's going to probably run around $70. And then those fees will then be collected by them. You don't have to send those fees to us to slow up down the process at all. And then you will be able to get those electronically. They'll be doing them electronically, verify the quality, and send them directly to the FBI. So this is hopefully going to speed up the process, eliminate monies and cards coming to us, and make it more accessible to everybody around the state.
Thank you. That sounds great. All right. Is there any other old business anybody would like to bring up? Is there any public comment at this time, Dr. Van?
Let me just check one thing. No, not on either of the in channels that we'd be looking for them. No, sir.
All right, we'll go ahead and move on to new business. Licensing personnel, Phyllis Johnson and Priscilla Bartholomew. Do y'all have anything that y'all like to bring to the committee's attention at this time?
We have an item on the agenda.
Okay, we'll get to that one.
You get that? Yeah,
when we
That'll
get
be an
there.
executive session.
yeah, okay. So then that's it then.
Okay. Thank you. Any public comment, Dr. Collada?
No, sir.
Move on to number 2 on the agenda that was included in your packet, apprenticeship for co-op standard. I included this in the packet. I received a call from Kathleen Warner at LSU E. She's head of the respiratory program there in Eunice, Louisiana. Their university was approached by Ochsner Health into starting some type of apprenticeship program. They received a grant to try to get students in the workforce a little bit earlier and until they finish their degree requirements. As everyone had a chance to look over the documentation that was sent, it's basically, from what I gather and speaking with her, is this would not be part of their clinical hours. They would be employed by the facility and doing tasks that the board would set. And as I told her, that was something that we're looking at when we look at the rules and regs and what can we do when, hospitals or organizations wants to hire students and kind of let them shadow before they finish their respiratory curriculum. So I don't, we had nothing in place right now. It was allowed during the COVID pandemic to allow students to work, be paid, and get their clinical hours. But that has since, the board has since taken that away, and CORE, has also taken that standard away. Diana, I don't know if you have any more to add as an educator. Would you?
Well, I mean, I read over the document and, I think there's a lot of things here, and that's the biggest piece is just exactly how are they wanting to utilize the student. There once was a time back, and again, it's been probably 10 years ago that LSU, before they paired up with Ochsner's up here, actually hired students. The students were responsible for stocking the units. They were responsible for doing ECGs. And at one time we did ABGs, but I think CLIA came in and set standards. So it took them out of doing ABGs. They would clean up the ventilators and set them up and get them ready to go. And this is years and years ago, they would actually go out and change out oxygen equipment. So I guess the question is, what are they looking at as far as having the students do? Because They can't initiate therapy without a physician order, and that's back under practicing with the licensure piece. I mean, that would be my biggest thing, because right now, as it stands, we don't have apprenticeships in our law, now that we're back into functioning like we need to, says you cannot work in that field of respiratory therapy without a license. So my bigger question is, what are they wanting to bring them in to do? They can't take a physician order and do anything with it. Yeah, you can run me some equipment. You can clean up some equipment. That's my question, is what kind of job description are they going to have?
Yeah, and in my discussion with her, that is what
Like
she's
in the
leading to.
Paragraph.
Mike, you're breaking up.
Raymond, can you hear me?
You're breaking up really bad,
Okay.
Mike.
Never mind.
And I
Okay, never
can
mind.
hear you better now. Go ahead. Go ahead, Mike. Let's see if we can hear you better.
Last paragraph, ending. Say again.
We can't hear you, Mike.
Mike, if you like, you can send it in the chat and Olivia will read it out for you.
Mhm.
Can't hear you.
Type it in the chat, Mike.
Mr. Raymond, if I might ask a question.
Yes, sir.
Ms. Dina, you said they would, quote, go out and change oxygen. What do you mean? Go to people's homes?
Oh, no. And again, a lot of things have changed in practice over the last couple of years. But when LSU was using the humidifier to go with the nasal cannula, okay, after 5 days, that had to be discarded, okay? So they could unscrew it, they could put water in it, they could reattach it, but all of this was in the hospital. The aerosol generators, the large volume nebulizers that were used, we were changing those every 24 to 48 hours. So they literally would go floor to floor, and those water devices that were due to be changed, they were changing those out. Now, a lot of the institutions use the prepackaged water things, which means when the water runs out, you change the device out. But it's, unscrewing it and screwing it back on is basically what they were doing. And if the patient was on 2 liters, make sure the patient was on 2 liters. That was it. Take it off, put it back on. And all of that came to, like I said, an end, and it might have come to an end once we went up underneath the BRI, but they don't have student worker positions anymore.
Well, so they're asking for an apprenticeship program. Do they have a clear outline of responsibilities, duties, and expectations? Because I really didn't interpret what they sent us to be that.
No. And she was looking for more guidance if we had something in place, which I told her we did not. And that's something, it's occurred across the United States with the healthcare shortages of respiratory therapists. They're looking to put now and using it as a recruiting tool once they get them into some type of respiratory assistant, whether it be, cleaning, picking up oxygen tanks and transferring them back and forth, getting them in as a marketing tool, to show them what the facility is like. That they'll be more apt to, when they finish their clinicals, to join your facility, versus another facility. I think, personally, I think the committee can probably do a little bit of research on this and, when we come to the rules and regs, see, if there's a place that we can, add in there what, we feel is in the law, within the law for them to do. Sheila?
What sort of things were they doing during COVID and getting paid for?
Whatever they finished in their clinicals and were being supervised by one of the therapists on that shift.
So Sheila, at that time, we were actually in a dual role where they were getting clinical training and yet they were being paid for it, only because COARC dropped that standard and we dropped that standard to get us through the emergency process. So the student wasn't being sent out there willy-nilly by themselves. They had to have a preceptor just like they did in school. But it got them back into the hospital and they were able to get paid for doing it.
But would that have been a hospital therapist supervising them, or they were getting paid actually during their clinical?
There was a hospital therapist that was supervising them, and yes, they were getting paid for their clinical. So if I was up in our surgical intensive care unit and there were, let's just say, 8 ventilators, and I took a student, then the 2 of us knocked out that work together versus the therapist having 8 ventilators on their own. And it also, I think, gave the hospital at the time, and again, I'm talking about the timing from May till about August 2020. It also gave the hospital, I think, a little bit more reassurance about what happens if one of these individuals ends up with COVID and ends up in the ICU, and who's going to be responsible for this. So they were running 2 roles, but the only reason we were able to do that, COARC said, we're in a bind here, let's utilize what workforce we can get, and they could only do what they'd been trained to do or were being trained to do. And the hospitals were willing to do that. But it was a very, at least in the Shreveport area, it was a very short-lived time period.
And it was a collaboration, the LSBM, BME and Dr. Van and all, they worked tirelessly to see what we could do, to get some extra hands in the workforce, to get these students to be able to graduate, because we knew we were going to need them. So everybody was involved and everybody was in agreement. Would that be a fair statement, Dr. Van?
Yes, sir, it would, and we appreciate the compliment.
Thank you. So my recommendation is that, we take this under advisement, do a little homework before we meet for our rules and regs and see, what we can do, because there are respiratory assistant positions being posted out there. I'll be honest with you, I have one posted myself, and the expectations are going to be, bringing them in, using it as a marketing tool, and they'll be doing things that not a licensed therapist do.
I like the idea because of, especially for smaller hospitals that have a hard time getting respiratory therapists to come into their hospitals for the job. If you can orient and, do a few months here and you see, I like this community, I like this team, it might be easier to get them into those hospitals as well with something like this. I think it's definitely something worth consideration.
Would it be appropriate to ask Oshner for a job description or potential things that they want this therapist to do, this assistant, so that we can look at our rules and regs and see if those are appropriate?
I'll request that from, the board can request that from Miss I've lost her.
Miss Wilson?
No,
Who you- no.
Kathleen
Warner,
Warren.
I think Warner, yeah.
Yeah, I lost her name. Dr. Van, I see your hand up.
Yes, sir. You said that you are hiring respiratory technicians,
Assistants.
assistants. Okay. Now, we don't license those people, correct?
No, sir.
No,
So
sir.
I'm trying to understand what would be the difference between these assistants and these now newly named apprentices.
I think they're one and the same.
I would think they're one and the same, but I think what Raymond said, I think we need to do our homework from who else is utilizing them outside of the state of Louisiana? That's what I would want to know. And what type of job responsibilities are you giving them? Again, to have somebody take a piece of equipment and roll it from one unit to another, clean it up, set it back up, and run it through its initial testing. Respiratory student workers, it's what we used to call them up here, did that all the time. And nothing in our licensure law says you must be licensed to clean the vent and run it through its diagnostics.
Well, and that's my point. If we currently don't, if we have these people and they can't fill the jobs as the respiratory assistant, what's going to differentiate an apprentice that's going to make it more attractive? I'm trying to sort that out. We could just have all of our students, if they want to moonlight, can moonlight as assistants.
Well, and again, I think that was the comment that was made when Kathleen sent some of this stuff, is she put down what COARC says you're going to have to do. So there is new language, and since I'm not involved in the accreditation process anymore for RTs, there was new language in there about apprenticeship. And I think that's what's got us kind of, again, wondering what does that mean? And there has to be memorandums of understanding between the schools and those institutions. And I think what Raymond was saying, we just need to make sure that when they start defining the apprenticeship, so if we came back and said, yeah, that sounds great, and I'm making this stuff up, and Ochsner says this apprentice will go out and set up oxygen, because that's one of the first things we learn in respiratory therapy school, like week 2. Well, in my mind, they're operating outside of their scope of practice because that's something that we license. However, we do say nurses who have a license and have been trained to do this could set up oxygen. And we've said other individuals who have a license, and of course, we're talking about a student who doesn't have a license, but if they're trained and trained appropriately, they could do it. So I think that's what Raymond is saying. We need to do our research and then make sure when they start defining this, those schools and our statewide institutions understand the limitations, and they need to work within, a set of goals, I guess.
But just so you know, there's nothing on the COARC website about apprenticeships, and that's why I'm kind of fuzzy on where we're going with this. But let's keep working it, and we'll try and get some information. We'll see about getting a letter off to this lady and see what she can tell us what their expectations of work are and why it's different from a standard respiratory assistant that y'all are hiring and for now. So we'll try and get that information for us.
Okay, and what she gave us, Dr. Van, it's standard 5.09 under the entry into respiratory care practice. And and when you read the standards, they'll give you an interpretive guideline. And some of the things that are underlined, I'll have to be honest to you, I didn't go back to their website and looked at it. These may be proposed changes because they are constantly changing this. But what Kathleen gave us came from COARC 2022. And it's up underneath standard 5.09. And because of the underlined, I can't tell you if it's in or it's proposed changes for discussion.
I'll be attending a meeting next month, as well as Sheila and some of the other Louisiana delegates for the summer forum meeting. I'll see Tom Smalling with COARC or one of his assistants, and I'll have conversations with him on the interpretive guidelines and what's his view on these apprenticeships versus assistants, and get some feedback. I will note Michael Nolan in the chat did say, I do think we need to take this under advisement.
How did Kathleen get involved in this?
Oshner's approached her.
But maybe we need to go straight to the source and not middleman, you know, wouldn't that be simpler?
Well, I mean, you can go to, you can, if Raymond has something there, we could pull that from Oshner's, but Kathleen is always going to refer back to licensure law and what COARC says.
Yeah.
So, and Oshner's, and I have to keep this in mind, Oshner's not only has hospitals in Louisiana, but Mississippi and Alabama. So their practice standards may be different from ours. So what is developed in Mississippi may be good in Mississippi, but would not be good in the state of Louisiana. So we need to do our homework.
So the students not getting paid comes from COARC. It's not just something that we have in ours, huh?
I think we wrote that in ours when we found that the California college individuals were out there
Oh, yeah.
doing all this work. And so, yeah, but it's, we work together on that, but it's both.
Okay, I think we've hashed this for a little while. I think we can do a little bit of homework. I'll get, I have more conversation with Kathleen. And again, like I said, I'll try to meet with Tom Smalling or one of his assistants from COARC next month and get his feedback and his view, what he sees in the future for
It helps
RT
to have
students.
people in high places like you.
Right. Sheila will be there too. All right, is there any further discussion on this apprenticeship issue? Is there any public comment, Dr. Van?
No, sir, there's not.
Okay, item number 3, upcoming meeting dates. Our next meeting will be September the 18th and followed by December the 4th, just as a point of interest. We do have an addition that we approved prior to the meeting started on the new business. Dr. Van would like to discuss a dual license CEU request.
Yes, we, as you know, we license 16 different classes of licenses. Our physicians and surgeons, which includes our DOs and MDs, we perfusionists, respiratory therapists, occupational therapists, PAs. We do lay midwives. We do a whole raft of licenses in various fields of medicine. And what we have is we've had one licensee, and you have to understand that he has probably never been audited because prior to the onset of the use of the CE broker to audit everybody, we just it was an honor system, and then if you were audited, you presented it, and then we reviewed it, and it would take a long time, and so we've eliminated all of that. But this particular licensee holds licensing in respiratory therapy and another area that we license. And he would like the other area of licenses approved CMEs to be recognized to renew his license for respiratory therapy. Now, for example, we may do respiratory therapy And we may do medical prescribing psychologists, but we don't necessarily allow physical therapists to utilize, who hold dual positions, to utilize their CMEs for physical therapy for anything else. And while it is all under the LSBME, it is separate licensing requirements that you all have got, all of our advisory committees have guided us in, and you have set the determining factors. And really, it would be something that we would have to take to the board if you feel strong enough that we would allow this kind of thing, because then it's going to be, well, I'm a PA and a doctor, but I don't have to do the PA requirements because I'm a doctor, or I'm a doctor and I do respiratory therapy. I don't have to do respiratory therapy because I'm a doctor. So, I mean, it's going to be mishmash. It's certainly going to be difficult for us, but we can set it up. But I think the best thing to do is to keep it clean. Each license you want to renew has the separate requirement, but I'm anxious to hear your thoughts.
Well, I can tell you somebody who's dual licensed, and you've never gotten this request from me, even y'all don't license PT. So in every 2 years, I've got to submit 30 for the PT, and then every year I submit 10 for y'all. And there have been times I've wondered what I've had for RT would fit for PT. PT does have the mechanism that I can send in and I can request them review a course, and if they will accept it. And I think I end up having to pay $25, $30. When we redid our rules and regulations, not that we had people coming in asking about courses, but, and again, I've slept since then. If it's still there, was a substantial amount of money you'd have to pay, where you would almost just go, look, let me suck it up and go get what meets the standards. So Dr. Collada, I agree with you. I think we ought to keep it clean. I think when we look at the revision of the rules and regulations, if we wanted to put a stipulation in there that you could have a course reviewed, that's something we can think about. But I know it was something we didn't want to get in the business of doing. And I have no problems getting so when you look at it over a 2-year period, I have no qualms getting my 50 CEUs.
Mike Nolan has commented in the chat, separate license, keep it separate so credentialing isn't bogged down, keep it clean.
I agree.
Beth agrees.
I agree also.
I also agree.
All right, well, thank you. That gives me a way to answer it, and if he wants to bring it to the board, I'll let this person bring it to the board. I'll talk to them later on today. Thank you for your input. Appreciate that.
Do we need to do a motion on that, Dr. Collada, or?
No, I think I have a gist of the will of the advisory committee here, and I'll just tell them that we discussed it and it was not advised to allow to be, it's not something the advisory committee recommends. If he wants to take it to the board, he can take it to the board.
All right, thank you, sir. That concludes our new business. We're gonna move into executive session. Do I have a motion to move into executive session?
I move.
Beth, do I have a second?
Second.
Second, Sheila. Any discussion? All in favor? Any opposed? All right, so we'll move into executive session. We'll wait to discuss anything until we're taken out of this room.
And there's no public comment at this time, and you should see a flag to join. So join the new room.
Gracie, I'm gonna leave you out here in the public room.
Okay, no problem.
Okay, it appears we have everybody back in the room. Dr. Van, are you there?
Yes, sir, I am.
All right, good. All righty, Diana, do you have a motion
Yes.
to offer?
I do. I'd like to make a motion that the licensee inquiry that we got, that the LSVME support giving this individual a current unrestricted license.
Do we have a second?
Second.
Second, Brett. Is there any discussion? All in favor? Aye. Any opposed? Okay, the motion carries. Dr. Collada, is there any public comment?
Let me check real quick. No, sir, there is not.
Roddy, in reference to the letter dated March 30th, 2023 from the law firm Epstein, Beckner and Green, is there a motion on the table?
I'd like to make the motion that the LSVME board write a draft, a response to the letter in keeping with our current rules and regulations
Do I
to
have a
their
second?
response.
I second that.
Best second.
Second. Is there any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, the motion carries. Dr. Collada, is there any public comment?
Checking again, and no, sir, there is not.
Okay. Does anyone have any comments before we close the meeting? With that, I'd like somebody to offer a motion to adjourn.
Motion to adjourn.
Do I have a second?
Second.
Sheila, second. Any further discussion? All in favor?
Aye.
Opposed? All righty. The meeting is
Thanks,
ended.
everybody.
Thank you.
Appreciate it.
Dr.
Thank
Van,
you.
I have a question for you before.
Sure.
Are we not streaming?
Yes, we're still streaming. You want to give me a
No.
call?
Huh?
You want me to call you?
Call me, yeah.
Okay,
It's a reference to something else, not with the board.
okay.
Everyone have a good week.
Yeah. Thank you,
You as
Dr.
well.
Hugo.
Thank you.
Bye, y'all.